Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 521,509 confirmed cases of COVID-19 in Canada and 160,255 cases in Ontario. Chatham-Kent has 593 cases and Sarnia-Lambton has reported 538 cases. Michigan now has 466,485 cases, with 24,790 cases being in Detroit. Today we are reporting 250 new cases of COVID-19 in Windsor and Essex County. 32 cases are related to outbreaks, 13 are close contacts of confirmed cases, 6 are community acquired, and 199 are still under investigation. We have had 6,323 cases since March. 4,913 cases are now resolved, and 1,305 cases are active and being followed by our health unit. 76 confirmed cases are currently in the hospital, and 16 people are in ICU. There are 129 suspected cases of COVID-19 currently hospitalized. It has been a difficult year for so many of you who have lost loved ones to COVID and other diseases and circumstances. Our hearts truly go out to each and every one of you. We are saddened to report an additional 3 deaths today. A man in his 40s from the community passed away. A woman in her 70s from the community has passed away. And a woman in her 90s from a long-term care home has also passed away. Our community has lost 105 people to COVID. 62 deaths have occurred among residents in long-term care and retirement homes. There are currently 34 active outbreaks in Windsor and Essex County, 14 in long-term care and retirement homes, 12 workplaces are in outbreak, 2 schools, 3 community outbreaks, and 3 hospitals. As we go into the holidays, we want to take a moment to thank all of you for all of your efforts this past year. We appreciate your attention to all of the public health messaging by staying home when you're sick, limiting your close contacts, maintaining a 2-meter distance from others, washing your hands, wearing a non-medical mask or face covering, and covering your mouth and nose with a tissue or using the inside of your elbow when you cough or sneeze. If you haven't already done so, please download the COVID Exposure Alert app at canada.ca. Our next YouTube session will be Tuesday, December 29th. We will update the numbers on our website with the exception of Christmas Day. We wish you all the best this holiday season and hope you will stay safe and healthy. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. The holiday season is upon us. Doesn't matter what religion or faith you practice. This is generally the time to celebrate all the good things that we have in our life. We can always say what we don't have or what we missed, but we can never think what could have happened and what we could have lost. The year 2020 has been a very difficult year for all of us. Just in our community, 6,323 people to date have contracted COVID. 105 people died as a result of COVID pandemic. Many people ended in getting seriously ill, requiring hospitalization and some ICU care. Many people lost their jobs. Many businesses suffered, but despite all of that, we need to move forward as a community. We need to be kind. We need to be considerate of everything and everyone around us. Some of you may be considering celebrating in person with family and friends. I want to remind our area residents that despite the good news that we have started vaccinating our long-term care home and retirement home staff, the threat of COVID-19 is still very real, and it is important that we celebrate the holidays safely. Continue to show your commitment by following key guidance from the province and your local public health unit, such as avoiding hosting or attending social gatherings except with people from your own household. You can try and host a virtual gathering or event that can still bring joy while keeping your family and the community safe. For those who live alone and require supports, can get together only as necessary with one other household that they keep consistent. Wearing a mask and maintaining a 2-meter, 6-foot distance from anyone who does not live with you. And staying home except for essential purposes such as going to work, seeking medical care, or getting essential items like food, groceries, or medicine. With the high case rates in our community and many outbreaks, I want to be clear. No matter where you live, the upcoming holidays are not the time to hold social gatherings in person, inside or outside, with anyone that is not part of your household. For many, this time of the year is usually celebrated by attending religious services, rites, and ceremonies at places of worship. Under the gray lockdown provincial measures, faith-based organization and faith leaders must continue to limit the number of people attending services at any given time at a maximum of 10 people. This limit of 10 includes parishioners, officiants, and staff. Broadcasting virtual services, rites, and ceremonies allows faith-based organization and places of worship to still meet the needs of their community without putting the worshipers at risk. Many of the churches in our area have already canceled their services to protect their people. Our collective action will make a difference in what we experience in January and into the coming year. Together, we can minimize the transmission of COVID-19 in our community, protect our healthcare system, and save the life of our friends and family. This is the time of giving. This is the time to be kind. This is the time to give gifts to everyone. And right now, the best gift we can all give is to give them the gift of health by following public health guidance to keep everyone around you safe. For those who are celebrating Christmas, I wish you a Merry Christmas. For those who are celebrating Hanukkah or already celebrated Hanukkah, Happy Hanukkah. And for those who are celebrating Kwanzaa, Happy Kwanzaa. And for everyone else, Happy Holidays. Stay safe.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Yes, good morning, Doctor. Good morning, Teresa. I believe today's number is the highest single-day case increase yet. What was your reaction when you saw that number today?
So I saw the number and I was surprised, but we had actually consulted with our epidemiologist, and he had given us some projections, so we were aware that the numbers were going to continue to increase. We know that there are continue to be cases in our outbreaks in the long-term care homes, so the number is high, no doubt, but I think we were anticipating that it is going to continue to be high in the next short while, hopefully only.
And Doctor, your reaction?
Similar to what Teresa said, I think it's unfortunate that now we are seeing these numbers consistently in the triple digits and consistently more than 150. It is a big risk to our community, and we want to remind people about this opportunity with everything that's happening around us to be safe, to follow all these measures to keep everyone safe. And I'm confident that at least in the next few days, when people start to follow all these measures, we'll start to see a decline in the number. But just like Teresa said, we can anticipate at least for a week that the numbers will be similar, or maybe they will show some sign of going down, but at least next week is very critical for us.
And can you tell us any more information about the individuals who passed away? Did the man in his 40s or the woman in her 70s have underlying health conditions?
So the man in his 40s, we are still looking at his information. So I'm not sure about any underlying health conditions. The other two people that have passed away, the woman in her 70s and the woman in her 90s, both had underlying medical conditions.
Okay, thank you.
Any questions from AIM 800?
Dr. Ahmed, we've been in the gray zone for about a week and a half now. I guess if we weren't in the gray zone, and we obviously seeing record numbers today with 250, if we were in the gray zone, do you think that number could be even higher?
Absolutely, and I think everything that we are doing is critical, and it will have an impact at least 2 to 3 weeks down the road. And we've been trying really hard for about, I don't know, like maybe a month and a half or longer, just to explain this to the general public as well, that we need to take early action, early intervention. And we made all of those recommendations anticipating that what could happen. And we are already seeing that when people don't take those measures seriously, this is exactly what happened. I just want to remind again that not all is lost. We can still bring back, we can still be better, we can still keep our numbers at a level which can be manageable for our community, and we have done that during the summertime. So I think it's just a matter of understanding that when we lose our guards, what happens, and we are seeing the results. And I really, really hope that people take this time and opportunity to do the right thing. Every day reporting 2 to 3 deaths, it's not a good sign for our community. And we all have to remember that we all have our loved ones who could be vulnerable and who could die if they contract COVID. So it's all our responsibility, and we all need to act.
You kind of touched on this already with the first question asked by the Windsor Star, but just in regards to the number of cases, and like you said, the next couple of weeks are very key. With the holiday season here, Christmas Eve tomorrow, Christmas Day Friday, and then obviously the week leading up until New Year's, if the public don't follow these safety measures, it kind of goes back to what you just said, you're anticipating a jump even higher than 250?
Absolutely, and all the indicators will get us to a level, then the containment will no longer be possible. And I don't know what other measures that I can put forward or what the province can put forward to contain it. Really, this is a very, very critical time, and we've always said, with all these lockdown measures, with all those restrictions, it works best if taken early. And all of those measures are completely and entirely dependent on everyone's behavior. There's no way it's possible to police everything that is unsafe in the community. Everyone is doing our part, like, you know, the municipalities, the law enforcement, the bylaws, our team. They are charging people, and they are issuing tickets. All of those information, all of those education / enforcement, that measures have been ongoing, but still there are violations. It's still, after 10 months of pandemic, there are people who either are not following the guidelines or who don't want to follow the guidelines. And this is what results. So if people continue to follow the same trend with that many active cases, we definitely run into a situation where containment will be impossible. So it's one of those things that I want to make absolutely clear, that all these measures are there to protect us, to protect our vulnerable in the community. And if we are not following that, we are putting everyone at risk. We are putting the lives of others at risk. We just need to be mindful of that.
And then one final one here. Obviously, like you mentioned, it's the holiday season, time where usually family and friends get together to enjoy. But obviously this year you're hoping it's different. I guess, what do you say to those, and it's taken a toll on everyone that are suffering, I guess, physically, emotionally, mentally. This is a time where they usually get involved with their family, friends, have a smile on their faces. It's going to be different this year, but what do you say to those that are dealing with some difficulties this time of year?
Well, the first thing that I would say, that I completely acknowledge and understand that, and I can speak at least for myself and for Teresa. We haven't had any family gatherings or any get-togethers with anyone that we really wanted. Teresa had children who really love Teresa, and Teresa loves them a lot. They're not meeting. It's very difficult. It's a very different time. So all of us have sacrificed. And if some people are thinking that, well, we are just sitting here and we're talking about it, but actually we're doing something different. No, we're not. We are staying to the people who live with us. And obviously this is a time when if someone is alone, if they want to get together with another family, they can. But find other ways, virtual ways to meet someone who do not live with you. Traveling or having large gathering, it's not advisable. It's first of all, it's against the regulation, and it's also not advisable just for the sake of safety of your own self, your own family. It's a difficult time. There is nothing that I can say that would help people think it differently, and I would just admit it as such. But we also need to think that what is at risk and what is at stake. So we, as much as it's the time that people want to do these type of events, do it virtually, be creative, find ways, and stick with your family, and then enjoy this time just with your own family.
Thank you.
Any questions from CTV?
Yes, hi, good morning. Do we know how many vaccinations have been given out so far, and at what pace will they likely be given out?
So that's a good question. I don't have that number, and maybe Windsor Regional Hospital can provide you with that number, that how many they vaccinated. We hope to get that information on a regular basis and share that information. Right now, I believe they are planning to vaccinate more than 1,500 staff and residents. But again, it all depends on the supply of the vaccine, that how quickly it's coming, and they're working on it. But at this time, I can't tell you how many they vaccinated yesterday.
Okay, and just a follow-up to that, do you think teachers should be included on the front line first to be vaccinated?
Well, there are...
Allow them to return to the class.
Yeah, no, good question. But there are some specific guidelines that are issued by the ministry, by the National Advisory Committee on Immunization. It's not necessarily just the likelihood of anyone contracting COVID. It's also the likelihood of the severity of the disease that if any of these individuals contract. So the priority population at this time is if you're going to call it like phase 1, it's the residents and workers in the long-term care home, retirement home, and other congregate setting that work with senior population, because we know that's the population that is most at risk. And then followed by the healthcare worker. And the reason for the healthcare worker is to make sure that if a healthcare worker is treating someone with COVID, they're not contributing it to spreading it to anyone else if they are sick for any reason. The essential workers, which we can classify our teachers maybe in the essential worker category as well, all of these workers will come in the phase 2, which includes like the police, the fire, and all those other peoples who are participating in those events. But at this time in phase 1, it's very clearly defined: people who are working with seniors, seniors with underlying comorbid medical conditions, and there is a formula, there is a prioritization list that is developed by the province as well as by National Advisory Committee on Immunization. And we are hoping that when we get more supplies, we will be out and doing more proactively all the vaccination, starting from our seniors in the community, and then going all the way to our frontline workers, and then we will do the mass vaccination of general public.
Great, thank you.
Any questions from CBC?
Hi, yes, good morning. Just to follow up on that, and perhaps it's a similar answer, but I was wondering about migrant workers and where they might fall in terms of priority groups. So if they're not in phase 1 in terms of that priority group, are they similar to teachers where you feel like they're not as at risk? Like, where do you feel like they should fall?
Well, in a broader definition, they fall under the congregate living settings because their living condition puts them at risk. But from a health consequences perspective, they may not fall into that high category of developing more severe complications. So it's a factor and combination of both these when these prioritization matrix are put in place. Even for the healthcare workers, there is a subclassification of which healthcare worker should get it first versus the other, because there's the vaccine. We don't have unlimited vaccine at this time. There has to be some additional criteria to even identify which healthcare worker should get vaccinated. So to me, phase one, I don't think at this time with the limited supply of vaccine that migrant farm workers will be included. But as we move forward with the other frontline workers with other high risk settings, then they will definitely be in the priority compared to the rest of the community.
Okay, thank you. The next question is, in terms of lockdown measures, we heard from the province on Monday and not much changes for Windsor-Essex. And I was just wondering why you decided to not issue any additional orders, given that you had been talking about wanting to see tougher lockdown restrictions. Do you still have any moves that you can make?
Well, I think my authority and my views are always focused on protecting the public health side of the things. And then even any other extra measures, it's better when it comes from the appropriate agencies responsible for making those decisions. What we were concerned about even before going down into the lockdown is more strict measures, more strict means to make sure that people are staying home. And then the areas that are currently open, they are following all those strict guidelines to work from home, and the places that are open to public, limiting and restricting the number of participants or number of patrons in that facility. With the gray lockdown measures that would start, the shutdown, the provincial shutdown as the Premier called it, it would reduce that number of capacity in these places that are currently open. So I'm hopeful that that would bring our case counts down. But the rest of the other measures, I think it does require much more broader provincial implementation rather than mine.
Okay, thank you.
Any questions from Blackburn?
Yes, good morning. I know you've been asked this before, but as cases mount, is there any more, how is contact tracing going? At what point would you stop, as other health units have done throughout the province?
So we're not ready to stop. We are using all the resources we can internally and externally. We continue to take the support of the province and onboard others. So on January 4th, the week of January 4th, we expect to get more case coordinators, and we'll continue to work as hard as we can. And not all of our interactions are as timely as we would like them to be, but our staff continue to work. The only day, well, there are 2 days where the health unit will be closed. And I say that knowing that we always have an on-call backup that gets important information and results. But on Christmas Day and New Year's Day, so our staff will have those 2 days off. Other than that, we do have staff working on COVID cases and contacts. So we'll continue to do the best we can. We will just persevere, stay on course, and try to manage the best way we can. Until there's a good rollout in our community, we feel our work of case and contact management is also a priority. So we'll continue to do that work.
Thank you.
Any further questions from the Windsor Star?
Yes, Teresa, you mentioned previously that the health unit was in discussions with a third-party group organization that may have been able to been hired or taken on to assist in case management or contact tracing. Is that what you're alluding to for January 4th, or is this something different?
Nope, that's part of the support we're getting is from the external group, and we are continue to be in discussions with them. And as because of the holidays, the resources, the human resources, and the proper training and all of that, takes a little bit of coordination. So I believe in January we'll have a more support, and also from the province we're getting an additional 5 case managers, and all of those people collectively help quite a bit. And so I do feel we'll have more support from the external company. They were approved through our board last Thursday, so we're happy to move forward with them, and are working very closely to get everything up and running as quickly as we can, knowing that January 4th is not very far away.
Okay, thank you.
Any further questions from AM 800?
No, I'm good. I just want to say happy holidays to everyone on the call. Thank you.
Any further questions from CTV?
No, thank you. Happy holidays.
Any further questions from CBC?
Yes, I have a couple more. I just wanted to ask, in terms of long-term care homes and what we're seeing with all of the outbreaks there, are you going to be taking any additional steps to try and address this right now, or is the status quo continuing?
So it really depends on the long-term care home itself, and we know at least one of the long-term care home in our community is continuing to see additional cases, which is a significant concern for us and all the partners that are trying to support the facility. There are a number of resources that are deployed to assist the home, but as we have said it before, we're not there 24/7. We can't say how things are being done. There are a number of ways that we are asking to audit. There are a number of ways we are trying to support them with providing with the staffing resources and everything that we can. Providing guidance to cohorting, working with their medical director to answer any questions, providing them with IPAC practices, on-site visits. So there's a lot of that is already happening, and if we feel that there's any specific need that we need to take measures which the homes are not following, we can think about getting to more extreme and issuing an order as necessary. But right now, what is happening every day with all these coordination calls and the outbreak response call, all of those things are already happening, and any shortage or anything that we feel, we will definitely do that. But I think right now at this time, we have to wait and see that if these measures are producing the results that it should, and we just have to hang on tight. All I can say is it is a big concern, and that's why we are all involved in supporting the facilities.
And we found out that Windsor was left out of priority community funding from the province, and I just wanted to hear your reaction to that.
Well, I think obviously I try to focus more on the public health side of the things, and we wanted to make sure that we get the public health issues under control. Getting these additional fundings in the region, it helps the community at large, and it also support many of the businesses, many of the individuals impacted by COVID. So I really hope that the province look at our community, look at our challenges and what we have accomplished over this time, and in so many ways. And it is unfortunate to see that Windsor-Essex was not included in the first iteration of whatever they call, but Windsor-Essex have received full fundings in other forms as well. So I'm not sure entirely about how much of that has happened, and I'll leave it to our political leaders in the community to advocate for all of that support. from public health, we want to just focus on public health issues.
I'm sorry, I'm just going to squeeze in one more question. Medical Laboratories of Windsor, they were supposed to have a machine for COVID-19 testing, and it was supposed to have arrived this month. And I'm just wondering if you can provide any updates on that. Is it up and running yet, or has it been delayed?
No, the machines are here. I've had an initial conversation with them. They are right now in the process of calibration and ensuring that everything is working fine. They hope to have their machines ready for testing sometime in January. I don't have a specific date, but hopefully that would help the community by having all these machines available locally. That would help our test results coming back in time. And we have been working with the ministry behind the scene and supporting all these applications and all these actions that would help our community, and all of that work is done. So when we are not talking about it, doesn't mean that it's not happening. All of those conversations are already happening, and hopefully 2021 will be a better year for us, and in every possible way.
Thank you so much. Happy holidays.
Any further questions from Blackburn?
No, thank you. Happy holidays.
Happy holidays, everyone. We'll see you on December 29th.
We got a good
Happy holidays.